Welcome. Thank you all for being here. Javier Becerra. I have the great privilege of being the Attorney General for the great state of California. I'm going to introduce to you the leaders of San Jose, Santa Clara, who will be making some remarks, but we're being joined by other leaders as well, who I'm hoping that Mayor Liccardo will introduce as we see them arrive as well, and they're joining us back here. I will give some quick remarks. I will ask Mayor Sam Liccardo to then say some words. We'll be joined then by our supervisor, County Supervisor Ken Yeager, to say some remarks, and then we'll be asking our County Executive, Dr. Jeff Smith, to please say some remarks as well. We're here really to talk about National Drug Take Back Day. It's not really in front of us for still several more days, the 28th of April, but it's important that we start now. And we wanted to come here today to talk about the efforts that we're all undertaking to try to make sure our families, our communities, we're all working to make sure that we're safely using medical prescription drugs, that we're safely disposing of drugs that are no longer needed, and that we're doing everything to stop anyone from becoming addicted to what can be a very deadly prescription. So I'm pleased that all of these leaders are here with us today. Those who are here today understand that combating drug addiction is not something you do by yourself. Prescription drug abuse has to be tackled on a team by team basis, a team effort overall. The epidemic that we face with prescription drug overdose and abuse is not just a major challenge. It's one that has to be tackled not just by law enforcement, but by our local partners in public health, our sister agencies like our mayors and county executives, and most importantly by our communities, our families, our parents, our siblings, our children. We in law enforcement cannot simply arrest our way out of this crisis. It will take all of us. And we can all play a role in combating this epidemic to help people heal, to help prevent them from becoming addicted in the first place. At the California Department of Justice, we're using all the tools in our toolbox to help combat prescription drug abuse. We, for example, investigate and prosecute prescribers who overprescribe prescription drugs, including opioids. At the California Department of Justice, we're in the midst of a national, multi-state investigation into major companies that manufacture, distribute, and sell opioids. Our Bureau of Medi-Cal Fraud and Elder Abuse combats prescription drug fraud against Californians who are seniors. We also administer the Cures Database, a statewide prescription drug monitoring program that helps cut down on doctor shopping and overprescribing practices. Prescribers, pharmacists, and law enforcement use the Cures database to prevent prescription drug abuse and diversion in our state. The California Department of Justice has certified that the Cures database is equipped to meet the needs of all prescribers in our state. All those prescribers in California are now going to be required as of October the 2nd of this year to use the Cures database before they prescribe medications to their patients. These are some of the important tools in our toolbox at the California Department of Justice. But just as powerful are the tools that we as citizens can use, starting with disposing of medications properly. Leftover, unused, or old medications can be deadly in the wrong hands. Imagine a young child swallowing a pill meant for an adult. We also know that flushing these medicines can poison our waterways, and needles thrown in the trash can not only injure, but might kill. That's why National Prescription Drug Take Back Day, coming up on April 28th, is so important. Thanks to the leaders joining me here today, thanks to the residents of San Jose and Santa Clara County, now you will have safe disposal sites where you can bring your prescription medication that must be disposed. It's an important tool that people can use to keep our waterways, our communities, but most importantly, our families safe. And it's a big step in the ongoing fight against prescription drug abuse. I'd now like to turn the microphone over to one of those champions and one of those leaders in this fight to make sure we curtail prescription drug abuse, our mayor of the city of San Jose, Mayor Sam Liccardo. Sam.
Thank you, General Becerra. Thank you for what you do for all Californians, particularly for being a champion of the most vulnerable of our community members. We're grateful to have you here in San Jose, and we're particularly grateful for the extraordinary work you're doing throughout the state. I want to invite our Environmental Services Director, Carrie Romanow, to join us. We're joined by many city officials here, including Councilmember Johnny Camas, Councilmember Chappie Jones, our Police Chief Eddie Garcia, Councilmember Raul Perales, as I mentioned, Director Romanow, and you'll hear shortly from Supervisor Yeager and from the CEO from the county, Jeff Smith. We are here united because we know this is a challenge that requires many hands and many partners. And here at the City of San Jose, we've been grateful to have great partners at the Water District, at the county. Indeed, our own San Jose Sharks have been important participants in our Don't Rush to Flush campaign. Certainly, General Becerra has described well the public health and public safety implications here. We know that 75% of all opioid misuse starts with people who are using medication that was not prescribed for them. They're obtained from friends, family members, or dealers. And we know, of course, that in too many cases, those are children that are getting into the medicine cabinet. And we know that too much of addiction, in fact, 90% of all addictions start in the adolescent years. So it's critical for us to spread the word to ensure that we're safely disposing of all drugs, whether they are of the nature that are like opioids or less serious or less threatening drugs, but in fact may have considerable impacts on our environment and our public health. We know the great risk to wildlife. Certainly studies have been done demonstrating challenges, for example, with contraceptives in waterways, with increased resistant strains of bacteria, with dispersal of antibiotics in the waterways. We need to make sure that all of our drugs are safely disposed of. And we're grateful for the partnerships we have had with so many community agencies, as well as private sector partners. I mentioned the Sharks. That effort with the Sharks alone enabled us to get more than 270,000 impressions on Facebook, because we've got a lot of avid Sharks fans. And I should point out, for the record, the Sharks are currently leading the Ducks 2-0 in the series. And I know General Becerra is here to catch the next game. So before I yield to my good friend, Supervisor Yeager, I just wanted to offer for our audience in Spanish, quisiera agradecer a General Becerra por su liderazgo y con los esfuerzos del condado y el estado de California en la ciudad de San Jose. Estamos trabajando para proteger nuestra comunidad de los riesgos a la seguridad y también por la sanidad pública de drogas, y quisiera asegurar que cada adulto está disponiendo de las drogas en una manera responsable. Thank you, and with no further ado, I'd like to introduce Supervisor Ken Yeager.
Thank you, Mayor Liccardo, and thank you, Attorney General Becerra, for being here as well. And thank you for the media for being interested in this really very critical issue. I am pleased to be here with my colleagues for about National Prescription Drug Take Back Day. This has actually been an issue that I've been working on for about 10 years. It's taken a long time to get to the point where we are today, where we have the bins now located throughout the county where people can safely dispose of their prescription drugs. But it was back in 2008 that I first then proposed this. At the time, we created a partnership between the county's Environmental Health Department, the Sheriff's Department, and Santa Clara Valley Health and Hospital System, who are all major players in this. The use of monitored, locked, mailbox-like bins allowed us to set up 13 drop-off locations at Valley Health Clinics and sheriff stations across the county to launch our program. And as you probably know, the reason why we did it at clinics was because we had sheriff patrol at the hospital and the clinics, and you needed to have public safety being near these prescription drop-off boxes, because these, again, were prescription drugs. Over the years, that partnership expanded to include local pharmacies, police departments, and proud to say the city of San Jose. 2 years ago, we had almost 30 drop-off locations countywide, disposing of 35,000 pounds of unwanted and expired over-the-counter and prescription drugs from county residents each year. However, that program was costing the county nearly $50,000 to operate. In January of last year, the county's new Safe Drug Disposal Ordinance went into effect. It requires pharmaceutical companies that have profited from these drugs to design, operate, and fund a program to safely dispose of residents' unwanted drugs. And I just can't emphasize that enough. These were the companies that were profiting from these, the sale of these drugs, and we felt that they needed to be the people that then had to pay for the disposal of the unwanted drugs. The ordinance ensures easy and convenient access for all residents to dispose of their unwanted or expired medications, requiring at least one drop-off site for every 20,000 county residents. Now that this new law is up and running, I'm excited to say there are now 57 drop-off locations at pharmacies and law enforcement agencies across the county. By the end of this year, we expect to have 100 disposable kiosks and numerous mail-in options available, more take-back options than any other county in California, all funded by the pharmaceutical companies who are taking responsibility finally for the products that they make. And again, I'm just very proud of the county and all of our partners, once again, sort of taking the lead in this really critical issue that I know other counties will be looking at. As the Attorney General said, this is a statewide problem, and we need all of our partners to be able to, again, dispose of these prescription drugs in a safe manner. I'd now like to turn it over to the county executive, Dr. Jeff Smith.
Thank you, Supervisor Yeager. As a doctor and a county executive, I can tell you that all prescription drugs are deadly. We often don't hear that because we usually use prescription drugs for a particular problem that we have. And used in the right way, they can certainly help us. However, used in the wrong way, they kill. So I'm very happy that we've embarked upon a program to protect the public from these drugs when they're not used. Studies have shown that individuals over 80 years old typically have about 10 prescriptions that they've given or that have been given to them by a doctor. And usually they have 2 or 3 bottles of those prescriptions. Oftentimes those drugs are stolen or misplaced or used by family members, and which results in addictions and death for many of their family and friends. We need to stop that. That means we have to have a place to turn in the drugs. That's why I'm proud to be a member of the county that took the lead in creating a system where we can recycle drugs and destroy them when they're not needed. And so I'm happy to be here with Attorney General Becerra, who's been the leader in the nation, who's providing pressure and using all of his force to come to bear on the pharmaceutical industry to make sure that they are responsible for the way that their drugs are used. So I'd like to turn it back to Attorney General Becerra.
Dr. Smith, thank you very much. We'll now take some questions.